I want to greet all the panel of judges. My presentation is on the knowledge and updates of hepatitis B post-exposure management among healthcare personnel influenced by the Cadre of Work Place. Introduction. Hepatitis B is one of the causative agents of viral hepatitis and recognized to be an important occupational risk to healthcare personnel worldwide, making incidence of hepatitis B infection to be higher among healthcare personnel compared to the general population. It was 10 times commoner in USA and 2 times commoner in Nigeria when healthcare personnel was compared to GP. Health Organization estimates that about 2 million healthcare workers face occupational exposure to hepatitis B virus each year, and that 90% of the infection that results from this exposure are in low-income countries, especially those in sub-Saharan Africa. The case in Nigeria is different when compared to countries with low prevalence of hepatitis B infection among general population. Nigeria falls into the higher epidemic region with hepatitis B surface antigen prevalence greater or equal to 8%, with prevalence ranging from 9% to 39%, compared to USA prevalence of 0.003%. The percentage coverage for hepatitis B vaccine is also said to be low, ranging from 20% to 50% among selected healthcare workers in Nigeria. It is therefore important to determine periodically knowledge of hepatitis B transmission and protection among groups of Nigeria which are at higher susceptibility to hepatitis B transmission, and to also determine if category of workplace influence uptake of vaccination and or post-exposure treatment. Research methodology. A descriptive observational study conducted between November 10, 2015 to December 11, 2015. Healthcare personnel working in blood-related units of various hospital categories in Osogbo, Osun State, Nigeria are defined. Healthcare personnel are defined as all paid and unpaid persons providing healthcare or working or training in healthcare setting who have reasonable anticipated risk for exposure to infectious material, including blood or body fluid, contaminated medical supplies and equipment, or contaminated environmental surfaces. Research sampling and sampling technique. 250 questionnaires were distributed among healthcare personnel in the professional master's program at LAUTECH, 5 randomly selected private hospitals, 5 randomly selected primary healthcare centers, and 1 mission hospital, all in Osogbo, Osun State in Nigeria. Results. Cadre of healthcare facility of personnel of participants. Teaching hospital 48.2%, primary healthcare 21.3%, private hospital 11.7%, general hospital 4.8%, missing 13%. Perception of risk of exposure to hepatitis B infection by healthcare personnel working at different cadres of facility. We can see teaching hospital 42%, primary healthcare 18.8%, private hospitals 12.5%, general hospitals 0.9%. We have missing data which is 25.9%. Socio-demographic data. Age 20 to 29%. They are 20 to 29 age 34, and the percentage is 14.8. From age 30 to 39, 98%. 98 the frequency, and the percentage is 42.6%. Age 40 to 49, 52 frequency, and the percentage is 22.6%. People that are older than 50 years, 41, and the percentage is 17.8%. Missing data, 5, which represents 2.2%. Total 230 in all, and 100% total. Professional status: nurses 147, 63.9%. Community health workers 29, 12.6%. Doctors 20, which is 8.7%. Laboratory staff 7, 3%. Ward 6, 2.6%. Microbiologists 2, 0.9%. Pharmacists 2, 0.9%. Admin officers 2, 0.9%. Social workers 1, 0.4%. Missing data 16, which is 6.95%. Time spent at workplace, as in duration of years. People that spend less than 12 years, 7 in number, 3%. 13 to 36 years, 81, 35.2%. 37 to 60 years, 30, which is 13%. 61 to 120, 31, which is 13.5%. 121 and above, 81, which is 35.2%. Total 100. Knowledge of healthcare personnel, the healthcare cadre personnel. Transmission: the total obtainable mark is 4,600. For the transmission, 2,505, 54.5%. Vaccination, 1,940, 42.2%. Post-exposure management, 3,245, 70.5%. Average score and percentage, 7,690. Percentage 55.8%. Discussion: overall mean knowledge of healthcare practitioner in this study is judged to be good, 55.8%. It is in agreement with findings of Samuel et al. And Abibat et al. 2009. Knowledge about exposure treatment followed by knowledge of transmission of hepatitis B appeared better understood than knowledge about vaccination. Second, the live vaccine, for which there have been rare but documented cases of congenital infection after administration are smallpox, yellow fever, and rubella. The available hepatitis B virus vaccine contains hepatitis B surface antigen produced in yeast from recombinant DNA technology and do not contain the whole virus. 86% of participants have been vaccinated against hepatitis B infection. This is similar to 70.2% of Emmanuel et al. In southwest of Nigeria and 72.7% of Abiba in Kuwait. This appears to be good, though almost 50% of participants bank on childhood immunization, and no testing is usually done after completion of schedule to test if they actually responded to the vaccines. The difference was statistically significant. The teaching hospitals are better equipped, understandably, but it was surprising that healthcare personnel at primary healthcare level have higher chance of being vaccinated compared to those in the general hospital. Recommendation: it is important that efforts are made at all levels of workplace, especially private hospitals, to ensure that workers are protected. Written policy on reporting of exposure and management of at-risk staff should be clearly documented. Ministry of Health to bring out guidelines for healthcare personnel protection against hepatitis B virus and ensure that health facilities comply. In conclusion, although knowledge of hepatitis B virus infection, transmission, and post-exposure is good among healthcare personnel in healthcare facility of Osogbo, most of the health facilities do not request for hepatitis B virus vaccination before employment. Neither are there clear policy on reporting of exposure to at-risk blood or body fluid. The risk of poor protection appear with healthcare personnel working in private and general hospitals. Urgent need to engage Ministry of Health to bring out guidelines for healthcare personnel protection against hepatitis B virus and ensure that facilities comply. Thank you.